Welcome to Reset, where we're transforming the way you handle demand in your practice, making it as rewarding as, well, finishing your laundry. All right, I know most of you are probably not too excited about doing laundry. Once I explain, though, I think you just might. But first, let's discuss the concept of access. You can think of access as simply the number of appointments available, which we call supply, minus the number of patients who have problems to address, which we call demand. If you have more appointments available than patients who have problems, you've got good access. When you have more patient needs than patient appointments, then you have poor access. When patients are having trouble getting care, our gut instinct is often to add more appointments to improve access. This makes sense in our brains. More appointments equal more care. But more appointments in a day also equals more stress. And we like to decrease stress. So in Reset, to improve access, instead of adding patients' visits, we choose to solve more problems. In other words, we improve access by addressing your demand. But how do we do this? In the current system, physicians and MAs constantly see their daily schedules fill up with not just their own patients, but also with the unending volume of cross-booked appointments from patients throughout Northern California. This creates a workload that can understandably feel super overwhelming. Reset addresses this by joining you and your fellow physicians and MAs into a unified team, about the size of a module, and placing your team and your patients on a designated island. We then turn off cross-booking between different islands so that you primarily handle demand from your panel of patients, as well as help other teammates from the same island when needed. This means patients from the mainland or other islands will no longer randomly force their way onto your schedule. Of course, we'll occasionally say aloha to unimpaneled patients who are passing through, but we'll be sure to do this by way of a round-robin system that equitably distributes the work among teams across your site. After forming your island, we give you a new schedule template to tackle your pent-up demand. Half of the template contains traditional call center bookable appointments for your patients, while the other half is wide open, flexible time for you to handle your patients' needs and work through your backlog, however you see fit. Which brings us back to the laundry. Think of all those patients' issues as individual pieces of clothes in a laundry basket. Since you're no longer taking care of patients from all over Northern California, you now have a finite load of laundry ready to wash. Before doing the wash, though, we'd like to separate the laundry into 3 different piles. Pile 1, today's work today. In medicine, there's always laundry to wash each day. In the traditional model with a constant influx of patients available to fill cross-coverage appointments, there's often minimal motivation to tackle today's tasks promptly. In fact, in order to cushion our day, sometimes we might even slip in some freshly laundered socks, like an appointment to discuss normal test results, or wash our socks more times than needed, such as rescheduling unnecessary follow-up appointments. On Reset, though, any problems you solve without creating extra appointments remains your own time. Say goodbye to kicking the can, or in this case, the laundry, down the road, and hello to efficiency that's rewarding. We have aligned the incentives now and freed you from all that inefficient stuff. If a patient gives you multiple complaints, you may choose to address them all in one visit instead of scheduling a future visit. Receive an urgent AACC or a concerning lab results? You may just grab the phone and handle it, or book it into your white space for a quick office visit. But don't feel pressured to adopt this mindset right away. You'll spend a few weeks mastering today's work today with tools like the Rescue DAR, the AACC Auto Book method, and learning to prioritize patients for priority access care slots. It might feel uncomfortable, requiring you to unlearn old habits. But it's kind of like learning to juggle flaming swords. Tricky at first, but totally badass once you've got it down. Pile 2, future work today. This is the phase that will gain you the most bang for your buck on reducing your laundry basket of demand. We're going through the house and collecting all the clothes in the kids' rooms and bathrooms and doing as much laundry as we can today. Patients no longer need to wait weeks for care. We're bringing the future to you, one sock or appointment at a time. To do this, you will learn tools called shuffling and scrubbing. Shuffling is moving patients around to open your future call center slots. And scrubbing with our awesome ScrubDar tool allows you to find a straightforward appointment 2 or 3 weeks out and take care of it today. At first, you will see those appointments further out rebook. But don't worry, because you will eventually reach the bottom of your pile of laundry and those appointments will stop filling. And again, you get to keep the white space you create. After all, who wants to get rewarded with more work simply for being more efficient? Pile 3, address your hidden demand. This final phase is like hunting for treasure. But instead of gold, you're finding those elusive socks under the bed or shoved in the closet. All those patients with MDP refreshable diagnoses are out there and need an appointment by the end of the year. So we'll teach you how to use batch messaging so that you can use the white space to bring these patients forward and wash them now when it's convenient for you and not during the typical end-of-the-year scramble. By following this framework and addressing all 3 of your laundry piles, you'll be crushing your demand like a pro. And when your demand decreases, it means you'll have extra appointments that go unused. In just a few months, you'll arrive at base camp and be hitting milestones that'll make your head spin. 90% open appointments next week, your patients seeing you 90% of the time, and 90th percentile for end-of-the-year MDP work, all with fewer templated appointments on your schedule every day. It's the beauty of maximizing access the reset way. Instead of adding more supply, simply manage your demand. So let's strap on your hiking boots, grab those laundry baskets, and let's conquer this climb together.